Hello, this is Restoring Resilience, Pain, Suffering, Inertia, and Recovery. I'm Dr. Jerome Lerner, the director of the Professionals Program at Sierra Tucson, and this webinar is sponsored by Sierra Tucson. Just so you know, you can submit a question on the bottom left of your screen at any point during the presentation. All questions will be answered during the last 10 minutes of the program. And you can find a PDF of this presentation and additional resources under the headshot image located on the left of your screen. For help or assistance, please contact Melissa Pangaro at the email listed on your screen. This is the continuing education credit information, and we're going to begin. Welcome to Restoring Resilience, Pain and Suffering, Inertia, and Recovery. So, to begin with, I like to talk about definitions. We use words all the time, and it's helpful to know why we're saying them and in what way. During this talk, I will sometimes refer to a concept I call inertia. You all remember that from your high school physics. A body at rest stays at rest, a body in motion stays in motion, unless impacted by an outside force. Now, I'm not trying to teach a physics lesson. You can take a breath. What I am doing is presenting the term inertia as a metaphor, because in my experience, the people that come under our care for help are in a state of inertia as a metaphor. Either we are bodies at rest, meaning we're stuck in our lives, or bodies in motion but heading in the wrong direction. The idea of restoring resilience is really about creating the energy to get stuckness moving and to get people moving in the wrong direction, to change directions. The other word that I use from time to time is recovery. And I think it's interesting to look at the dictionary definition. The first one is a return to a normal state of health, mind, or strength. And the second one, which I really like, is the process of regaining possession or control of something stolen or lost. And here, again, my experience has been that people who come seeking care and treatment typically feel that they've lost a part of themselves. And they want to find it again. They want to be their best self or their truest self and get back on track. And to me, that's the larger definition of recovery. A lot of people use the word recovery and they think of addictions. I look at recovery and I think of any condition or situation where a cure will not take place. You can cure pneumonia with a week of antibiotic, but things like addiction, trauma, depression, anxiety, chronic pain, these things are not cured, but when people live a life of recovery and resilience, they can live a healthy and normal life. So the term resilience, it has a physical definition, and if you look at the pencil on the right, if you bend that pencil, it's going to snap and break. Physically, it does not have the resilience to bounce back. If you look at the plastic ruler on your left, when you bend that ruler and you let it go, it returns back to a normal position. That on a physical level is resilience. We're using the term on a psychological and emotional level where we're looking to create the circumstances where a person can bounce back when there's a difficult time. So this is life. This is resilience and recovery. At its best, we have good times, we have bad times, and hopefully when we have bad times, we bounce back and find that happy place again. That is living in resilience. In resilience terminology, we call the happy face harmony and the sad face disharmony. And life is a blend of harmonious and disharmonious moments that hopefully we create the capacity to bounce back to a state of harmony. Here's that first inertial state, the body at rest. Something bad happens or we do something wrong and we just stay in that bad space. We don't bounce back. We grieve the loss of something and we just don't stop grieving. We start using a substance inappropriately and we don't have the capacity or judgment to bounce back, to make a change and get back to normal. So here's that inertia taken one step more, a body in motion heading in the wrong direction. So something bad happens, or we do something that's not so good for ourselves, and instead of getting back on track, we just pile on. We keep heading in the wrong direction. We do a compensatory strategy that just makes it worse. We're sad or depressed or anxious, and we take a drink to deal with it instead of dealing with our anxiety in a healthy way. And we keep drinking more and more as that gets less effective. That's the spiraling out of control. In resilience terminology, there is a continuum. We talked about harmony to disharmony and then back again. That's resilience. But when we don't bounce back and we stay in that disharmonious state, that becomes our new normal, and that's functioning in dysfunction. And when that dysfunction becomes a new normal and begins to head downward, that then is what we would call a disease state. So harmony, disharmony, we have some happy moments, we have some unhappy moments. But when unhappy becomes a mood and hangs around for a day or many days, that becomes a dysfunctional state. And when that unhappiness stays for months, that is a disease that we call depression. And when that depression is not treated and headed back to a more harmonious state, that can lead to disintegration, which in clinical terms might lead to suicide or suicide attempt. So that would be the downward spiral we're talking about. We can apply that to anxiety. We can apply it to substance use. We can apply it to medical conditions such as eating poorly leading to a disharmonious state of blood sugar, which could lead to a new set point for our blood sugar, which could lead to diabetes and then to the complications of diabetes. So this resilience terminology and thinking really can be applied to both physical, medical, and psychological states. And in our treatment, where I work at Sierra Tucson, we see a variety of challenges that bring people to our facility, but all of them require a restoration of resilience. If people were in a state of resilience, they wouldn't be coming to a place like Sierra Tucson. They would use their resilience strategies and bounce back. So by definition, they are in a place of inertia. I've been in practice for about 35 years now. It's hard to say that. And I have made it sort of my curiosity and my study, personal study, to understand why some people get better and some people get stuck. I've applied that in my work when I worked with major physical disabilities. I applied it to my work when I was involved deeply with chronic pain situations. And I look at it now working with addictions and trauma and mood disorders. Why do people stay stuck? I keep asking that question. And I've discovered in my own thinking there are three major resilience or inertia points that need to be addressed that are universal. The first one has to do with lifestyle, which is really about the biochemistry of depression and pain. The second one is about living in the survival mode, the sympathetic mode of functioning, which is the psychophysiology of trauma triggers and distress. The third universal principle of resilience or inertia is negative thinking, the thoughts, beliefs, and judgments that lead to hopelessness and numbing strategies. So those are the challenges. With that, there are three universal resilience strategies that help bring that back to a healthy state. The first one we're aiming for is a healthy lifestyle leading to a happy chemistry. The second is creating a balanced nervous system that allows us to be present and creative. And the third universal resilience strategy is conscious thinking, which allows us to have directed thinking and outcomes. I look at these three universal resilience strategies plus a fourth strategy, which I'll explain in a moment, as being four dials or tumblers on a combination lock. You know these locks. You have them on your bike or your gym locker. And just like this combination lock, if you dial three of those into the right position, but you ignore the fourth tumbler, it's just as locked as if you hadn't done anything. And to my experience, people before they come to a place like Sierra Tucson have tried things. They're trying to get better. And for some reason, either because they're not aware of a third or fourth tumbler they're not addressing, or they're not willing to address it, it feels like their situation is locked. They're not getting better. Either the strategies they're trying help briefly or they're not helping at all. Rather than saying these are not useful or helpful strategies, because they typically are, what I say is that people are missing the totality, the whole system that allows things to open up and restore resilience. The fourth tumbler, by the way, is the one that is their specific challenge for getting better, the one that brings them into treatment. So let's look at the first universal tumbler. That's lifestyle, the biochemistry of depression, emotional dysregulation, and pain. And the first thing I want to talk about in this category is something called systemic inflammation. First of all, I have to differentiate that from acute inflammation. You all know acute inflammation. That's the picture on the left. When someone gets a cut and it gets infected, we mount an acute inflammation response. That's necessary. It's a survival mechanism that fights off the infection and heals the wound. So we're not talking about that. We all need that. We're talking about an invisible inflammation. It's in our blood chemistry. We call it systemic or metabolic inflammation or chronic inflammation. It's invisible but can be measured by certain lab tests. This invisible inflammation is important because it has a lot to do with a lot of the problems we have in life. We've known for over a half a century through science and investigation that this invisible inflammation is the direct driver of cardiovascular disease. Having excess inflammation over years and decades leads to a change in our cholesterol and a change in the stickiness of our platelets, and we develop plaque and eventually a heart attack or a stroke. So we're not here to talk about that today, but that is indeed a very significant problem related to inflammation. More to the point, for about 10 or 12 years, there has been research that clearly shows that there's a direct correlation between the severity of systemic inflammation and our propensity for depression. Additionally, now, more recently, we have evidence that inflammation is a direct cause of dysregulation in the brain, mood dysregulation, emotional dysregulation of all sorts. And additionally, for those of you who work with chronic or complicated pain issues, increased inflammation is directly related in both animal and human studies to the severity of pain reaction to a pain stimulus. And I call that the tenderness aspect of pain. So for all sorts of reasons, we need to address the systemic inflammation. There are 5 major lifestyle factors that are going to directly impact whether we're pro-inflammatory or anti-inflammatory in our lifestyles. Diet, exercise, stress, sleep, and smoking. And there's nothing a physician or a medical practitioner can do that passively normalizes that for any individual. These are lifestyle factors and habits that have to be done actively by the person to normalize it. We don't have time today to go into all the specifics. Each one of these 5 aspects deserves an hour or a day. But I can tell you very briefly that there are foods that promote inflammation. There are foods that are strongly anti-inflammatory. There's all sorts of literature available in books and on the internet that can help people to eat better. And this is an important and a necessary factor for getting our chemistry in balance. Likewise, there is a lot of research now that confirms that exercise is necessary to normalize our blood chemistry and our inflammation. What we're aiming for here is moderate exercise. Again, there's a ton of literature on that and some disagreements and some ranges that are appropriate. Moderate exercise is going to change depending on the age and conditioning of an individual. But to say that everyone needs to move their bodies basically on a daily basis is necessary to normalize inflammation. The stress factor is important. There's a study that I'll tell you about briefly. They took a bunch of college students, this is a psychology department, and did blood tests. They drew blood tests on them before and after the study. Before the study, they draw blood that measures in all sorts of clinical and experimental ways levels of inflammation. They put these people down in front of a TV monitor, and they show them pictures of very distressing and awful things, war scenes, famine, children crying, et cetera, et cetera. And then 15 minutes later, they take another blood test, and the level of inflammation goes up. This is just an indicator of how sensitive we are in our biology to stress. And we human beings, being who we are, do not require pictures on a TV screen to be stressed. We have a lovely projector in our brain. We think about difficult and bad things that happened yesterday, or worry about bad things that will happen tomorrow, and we create our own internal stress response. So we need to create ways to calm our nervous system on a daily basis. These can be a mindfulness or meditation practice, or other ways to daily reset our stress system. The 4th aspect is sleep. The research is very clear. You don't get enough sleep, inflammation goes up. And likewise, when inflammation is up, it's harder for the brain to go into sleep mode. So it's very important to address all these things to normalize sleep. And last, there's smoking. There's a ton of literature on the negative impact of smoking, but in this case, we're looking at the chemical inflammatory aspects of smoking, and I urge all people to reduce or eliminate smoking in order to normalize this inflammatory state. For me, I can't tell people to do all these things perfectly because I can't do them perfectly. But I urge people to take little steps and little changes in their habits in all of these 5 aspects to slowly get things in better balance. And there is research to show that any change in a positive direction in these behaviors has a positive impact on the inflammation. Now, there's another aspect of inflammation in more recent research. There's something called microglial cells. These are the support cells in the brain and central nervous system that help the neurons be healthy. And it turns out the microglial cells morph actually into inflammatory cells when the brain is stressed. And right now the research is showing that not only life stress and infections, systemic infections, create that inflammatory state, but brain trauma, which is now very closely studied, in the NFL and the effects of multiple concussions, and that chronic inflammatory state, and also alcohol and opiates create an inflammatory state in the brain. The problem with this, the research is showing, is that the more the microglial cells have been challenged into an inflammatory state, the more quickly and intensely they go back to an inflammatory state with repeat exposure. Thus, the need for a lifelong recovery, healthy strategy to keep our brains healthy. We're more sensitized to an inflammatory state when we've been exposed to these things. All right. So there's even more here to talking about our body chemistry. We've been talking primarily about inflammatory and anti-inflammatory chemicals. But the other thing that these lifestyle changes do, they increase endorphins, which are happy chemicals. They increase serotonin, and they lower excess adrenaline, which creates a state of anxiety or stress in our body. And if we add a few other lifestyle changes like healthy touch, whether that's a healthy relationship, a hug from a friend, petting an animal, and then also exposure to sunlight and nature, these things further boost chemicals that make us happy. Oxytocin, which helps us feel connected, and serotonin, which sends us into a happy mood. And so you do all of these things and you're really creating a biochemistry of happiness. I don't say that doing these things means that you'll never be depressed or anxious, because that's not true. But if we're trying to be resilient, why add the propensity to go into a depressed, anxious, or dysregulated state? Resilience requires that we minimize that state. Okay, so for our first strategy, we got to normalize inflammation, reduce anxiety and adrenaline, increase serotonin, increase endorphins, increase oxytocin with the various strategies we just talked about. I've got to move on to tumbler number 2, the second universal strategy of resilience. That's moving out of the survival mode as a primary way of living. And it involves the psychophysiology of trauma, triggers, and suffering. So to start with, we talk about sympathetic overactivity. I imagine that everyone listening to this talk is very familiar about the sympathetic and parasympathetic nervous system and their role in our physical and psychological well-being or distress. But I think it's useful to very briefly review the sympathetic nervous system and what it was designed to do. This is a wonderful system. It's a survival system that activates automatically. It's part of the autonomic nervous system. And it is wired into our system and was wired into the system of our ancestors and all the creatures of the earth to improve the likelihood of survival when we're physically threatened. Our ancestors living out in nature needed this, and we would not be here today if we didn't have this lovely survival response. If they're outside and they bump into a saber-toothed tiger, their system, sensing the threat, quickly and intensely goes into a sympathetic mode, releasing multiple chemicals which make us faster and stronger so that we can quickly climb a tree, get to a cave, and if we can't run away, grab a stick or a stone and fight off that wild animal. Now, that's a wonderful thing, and it was designed to last for moments or minutes to escape the threat and then restore balance to the parasympathetic-sympathetic system. Very quick, intense response. So there's a problem, though, in our modern world. We activate the survival system for metaphorical threats, for metaphorical saber-toothed tigers. We rarely bump into physical threats, but every day we have metaphorical threats. If the job isn't going well, metaphorically that's a threat. How am I going to pay the rent and buy food and have a home? If I can't pay a bill I get, what's going to happen to me? It's a metaphorical threat for survival. If we have relationship distress in important relationships, we are social creatures and we go into survival mode because we feel threatened when our close relationships are not going well. And we extrapolate this reaction to more remote things, traffic jams, waiting in line at the grocery store, and for sure just sitting in front of the TV and observing someone 5,000 miles away having a bad time, and we have a fight or flight reaction. Because of our wonderful neocortexes, we can imagine that happening to us, and we get distressed, and we go into some form of fight or flight, anxiety, worry, anger, etc. There's a problem with that. The system was designed to go on quickly and intensely for a few moments to get away from a physical threat. But many of us, keep the system on most or all of the time, and that creates problems. First of all, when we go into fight or flight, the chemicals released increase muscle tension to prepare to run or fight. That's great if you have something to run from or fight because you burn off those chemicals. But we don't have anything to run from or fight in our modern world. And so all we do is create muscle tension. And that muscle tension creates distress and sometimes pain, and that's problematic. Additionally, it's not a problem for a few moments to get away from a saber-toothed tiger to divert energy and resources from our digestive system and our immune system. Not a big deal for a couple minutes. But when we're living in the survival mode much of the time, these necessary functions begin to not work well. They get dysregulated. And what do we see with the populations we're taking care of, with depression, anxiety, chronic pain, trauma, etc., addiction? We see people complaining of GI problems. Most of them are functional and not diagnosed as disease, irritable bowel syndrome, and all sorts of other complaints because the digestive system is dysregulated. And the immune system, likewise. When that's dysregulated and resources are taken from it to charge up the very intense survival system, the immune system doesn't work well. And guess who's more likely to come down with the cold or flu that's going around? The person who's stressed. We all know that. The immune system has been compromised. Also, when we're in survival mode, think of our ancestors who got away from the saber-toothed tiger and now they're going to sleep outside. They've got a hyper alertness that does not allow them to sleep or sleep deeply if there's any sense that that saber-toothed tiger might be in the neighborhood. If they're so tired they have to sleep, they wake up at a slight rustling of the bushes. So sleep is impaired. Now, there's one other thing I need to say about this, because whether we acknowledge it consciously or not, there are survival emotions related to the activation of the survival nervous system. Fight equals anger, and flight equals fear. And when we live in a survival mode, whether we consciously acknowledge it or not, we have heightened our experience, our life experience, by the difficult emotions of anger and fear. And that colors our life in a way that I would call a suffering mode of living. Now, that's just everyday stress, everyday metaphorical saber-toothed tigers. On top of that, the science that we understand right now, people living with unresolved trauma and people living with unaddressed adverse childhood experiences have a hypersensitized nervous system that tends to keep them and more intensely activate that survival nervous system with less of a cue. So we are activated into our trauma response or triggered emotionally more easily when these things are living under the surface. And so these things need to be addressed, whatever, the challenge that is most prominent. From the perspective of a place like Sierra Tucson, we feel that part of restoring the balance to the nervous system is healing the wounds, healing the traumatic events, getting in touch with healing the child that did not get certain needs met or lived in an unsafe environment, healing the child that lives within us as adults. So a couple of resilience restoring strategies that we need to do. All of us on a daily basis need to soothe and move. That's the daily reset for all of us. Soothing can mean meditation, relaxing in nature, listening to healing music, petting the animals. Water is very soothing for a lot of people, whether that's showers, baths, hot tubs, swimming, or listening to water move. The other part is moving. All exercise and sports mimics fight or flight. Everything we do in those physical activities is either a flight activity, running, walking, swimming, biking, are all flight activities, and activities such as pushing weights or hitting a ball are fight activities, and they help burn off the stress chemicals that have been released by the events of the day. So soothing and moving, that's a life strategy every day the rest of our lives. And for individuals who are living with traumas or triggers, the need to more intensively and therapeutically address both the trauma response and, when necessary, to heal the events or the experiences that overactivate and oversensitize that sympathetic nervous system. The third universal principle has to do with negativity of thought, which leads to hopelessness and numbing strategies, and to investigate and utilize the power of our thoughts for healing. So, negative expectancy. When people live with anxiety, with depression, with traumatic responses, panic attacks, or shutting down, with substance use that they aren't able to will to stop, or chronic pain that they can't make go away, we tend over time to anticipate a negative experience moving forward, because that's been our experience over and over, despite what we've tried to do to feel better. Negative expectancy can look like waking up in the morning and just having a thought or a felt sense that it's just going to be another bad day. I could get out of bed, but that panic attack's going to happen if I go outside, or I'm just going to feel down and not want to do anything, or my back pain is just going to activate and send me back to bed, so I might as well skip the movie or the dinner I plan to do. And so that negative expectancy creates a sense of hopelessness and actions or inactions based on that judgment or projection. So our lives actually change based on the negative expectancy. And it's not just today. We project looking forward. This week's going to be bad. This year's going to be bad. This semester's going to be bad. This job's not going to work out. And we go further than that, many of us, when we haven't been able to make positive changes in our life. We might have images or projections of a future in old age where we're alone and we never had that loving relationship, and we're alone in a nursing home, uncared for, and all of those things. So our projections are very important, and many of us, by habit, have learned to project that bad things will happen. This negative expectancy leads to, if we don't have a resilience and recovery strategy, it leads to numbing strategies. Because who would not, if they believe and they perceive that their suffering is unending, who would not seek anything that would give them even temporary relief and comfort from the awfulness of not only this moment, but the moments they're projecting into the future. And so here shows up addictive behavior, substance abuse, addiction, because, number one, they work. In the beginning, they work. I'm uncomfortable in my body, and I have a few drinks, and I'm happy, and I'm outward, and I'm social, and it's a wonderful thing. I'm feeling hurting inside. I can't explain it. I don't even understand it. I take an OxyContin, and for a while, I feel like the world is good. On and on. We do these things because they take our misery away or they make us feel good briefly. But as we all know, the more we use them, the more tolerant we become to them. We need more and more, and we get less and less a response until we don't feel good taking them, but we feel awful not taking them because we are now physically dependent and addicted. And it's not just substances, of course. We may numb up in front of a television watching 16 hours of soap operas. We could be shoveling a gallon of ice cream down us. We might sleep 16 hours a day to escape life. Work, gambling, sex, etc., can all be used as numbing strategies. And when that happens, because we're numb, we're not in a resilient mode. Our self-awareness decreases. We're unlikely to be able to make the choices that are healthy and bring us to a more positive state. So, in addition to this negative expectancy, which leads to behaviors and judgments and actions in our lives, there's something akin to that which we can call negative goal setting, that sets in with people that have been stuck in a difficult and painful and suffering mode for a while. When I talk to many people who come for treatment, and I ask them what they want out of treatment, they often tell me what they don't want. I can't stand this suffering anymore. I'm miserable because I can't stop using fill in the blank, alcohol, opiates, cocaine, whatever it is. They're telling me what they don't want when I ask them what they want. And they've come to believe that that's their goal. I just want to get out of my pain. I want to get out of my suffering. Unfortunately for them, the brain doesn't work that way. When we think of negative things, when we think of anything, we move towards that and we enlarge it. So when I tell you at this moment, please do not think of a pink polka dot elephant, I'm going to guess that all or almost all of you have thought of a pink polka dot elephant in the last few moments. When I say I don't want to be unhappy, the image, the object of that sentence is not being happy. And that's the image and the felt sense of the thought. And so we enlarge it and we feel the not happy we don't want to feel. And we get the distress and the inflammation of the stress and the fight or flight or freeze of that experience. And so we're actually creating a negative experience. I often use the analogy of GPS. If you get in your car and you turn it on and you turn on your GPS and in the destination you type in not here, guess what kind of helpful information you're going to get? None. This is the way your brain works. You can't type in not here, not this, and expect to get any kind of useful strategy from your brain to get somewhere good. So we have to flip negative thinking into some form of positive thinking. So if the addiction wasn't getting in the way, if the depression, the anxiety, the panic attacks, the pain was not getting in the way, what do you want your life to look like? your personal life, your interpersonal life, your body, your health, your work, your avocation, your spirituality. What does that look like when X, Y, or Z is not getting in the way? And we have to consciously begin to feed those images and thoughts into our thinker. We have to catch the negative thoughts, challenge them, and put some positive stuff in its place. So I think I have enough time. I'm going to tell you a brief real-life story here. You see the picture on the right. When I was a kid, about 12 years old, I was playing with a couple friends at the neighborhood park. And picture me at 12. I'm overweight. I'm non-athletic. I'm the kid. If there's a pickup team at the playground, I'm like one of the last to be picked. You remember that kid, right? So I'm playing with a couple buddies in the park, and there's a little stream, a creek that goes across it, maybe no more than 3 feet across. And my buddies just jump over it, and I'm coming up to it, and my thought is, oh my God, don't jump in the creek. It would be so embarrassing if my foot lands in the creek. Now, you all know where my foot went, because that's where my thought was. Fortunately for me, sometime that year, I actually came across a book my dad had been reading called Psycho-Cybernetics. Some of you might remember that if you're old enough. And I think it's still out in its umpteenth edition. And it talked about the power of, or the effect of, directing our thinking to how it affects the outcome. And I practiced in my mind jumping over the creek without physically practicing. And I went back alone to the park and imagined jumping over the creek and feeling my foot land on the dirt on the other side. And lo and behold, without any physical practice, I had the capacity to jump over the creek. So I am not saying this to be magical. If the creek had been 6 feet across, I could have imagined that all day long and jumped and still gotten wet. But that's not the point. It's not to be magical. If it was 6 feet across or 20 feet across, and what I wanted was to get to the other side and stay dry, now giving myself that image, my brain has a capacity to problem solve. I could build a boat. I could find a bridge. I could look for a pathway that gets around the creek. So we need to be realistic, and I don't like magical thinking, but we need to direct our thoughts where we want to go in order to get the GPS signals and information to begin to go there. Okay, so another negative thinking is secondary gain. I like to think of it like this. Everyone who comes for treatment has a primary loss. Something has gone wrong. They've lost a part of themselves and their well-being, and they're seeking to recover that. But with every primary loss, there's a potential for a secondary gain. So that's like making lemonade out of lemons. We all tend to do that. Secondary gains can look like this. When I'm in a sick role or an unhealthy role or a suffering role, I get attention and nurturing from people I love that I don't get when I'm well. Or I get out of doing household tasks or the job I hate doing. Another secondary gain is I get a doctor to prescribe the numbing medications that I want and legitimize them. So there are a whole variety of secondary gains. And those are the little voices that whisper in our ear, despite our big voice really wanting to get better. That little voice, when things get difficult or too stressful, that tells us to have a little way out. Not quite committing 100% because I've got that little thing I don't want to quite give up. And unless you've consciously strategized, hey, I'm not well, but if I get well, I have to go back to this job I hate or this job that's dangerous. You've got to listen to that voice and create a strategy for that little voice in order to be fully engaged in getting better. So the secondary gain is not bad. It's just a hard to hear voice that needs to be acknowledged, and its needs need to be addressed in order to 100% buy in. So the other area of negative experience, another way to look at it, is we have it with ourselves. So there's a voice in many of us that's very self-critical, can actually be self-abusive. You know, you worthless pile of you know what, and we tell ourselves that even though we're very compassionate with others. And that needs to be addressed. We need to catch that and challenge that. It can happen in our primary relationships where people that are central in our lives are sending us verbal or nonverbal messages or physical messages that were not good enough, that were bad. And that can be in the form of abuse or negativity that drains energy needed for our resilience. And then also we see as a very important part for many people a disrupted relationship with their universe, spirituality, meaning higher self or God, which benefits from repair and visiting and healing that in order to get better. So in summary, with the third universal strategy, we challenge negative thoughts and beliefs. We replace negative goals with positive goals. We can utilize things like affirmations, vision boards, new me exercises. Gratitude practices have been scientifically affirmed to make positive shifts in our thinking. We listen to and address secondary gains. We heal or create boundaries around dysfunctional relationships, and we replace negative numbing strategies with healthy comfort and distraction strategies. Just for a moment to explain that, a comfort strategy may be treating yourself to a scoop of your favorite ice cream. A numbing strategy is sitting down with a gallon of that ice cream and shoveling it down your throat. Likewise, with a whole number of things in life, they can be either numbing, if misused, or comfort and distraction. So some people may be able to comfort with an occasional glass of wine, and others, if they do that, they'll end up dead down the line. So we have to look at what we can safely do for comfort and distraction, but we need a list of those things, and we need to strategize them, because when we've been activated in survival mode, we are not going to be creative and come up with things that help us comfort and distract away from our problems in a healthy way. So getting a list of things we do. I'm going to take 3 deep breaths. If that doesn't work, I am going to find a quiet place and meditate for 5 minutes, or I'm going to call my friend or my sponsor, or I'm going to play with the pets, or I'm going to listen to music that really works for me. Have your list available of healthy comforts and distractions so that you can deal in a healthy way with the difficulties of life. So the fourth category we're not going to talk about today, that fourth tumbler is your unique challenge, typically that brings you into treatment. And for that there will be specific strategies that your physician, your provider, your therapist are going to come up with to help you deal with that specific thing. And those 4 tumblers, when addressed as a whole, as a totality, creates resilience. So that restoring resilience, that anti-inflammatory lifestyle, the healing of trauma and triggers, and getting that sympathetic mode into a balanced mode, the positive focus of thinking, challenging negative thoughts, creating a life vision, affirmations, and gratitude, and engaging in the specific strategies of your specific recovery challenge. And that is resilience recovery. I thank you for your time. We'll have some time now for some questions, and I wish you all a good and resilient day. our first question relates to research that connects to the topics we've talked about today. The question is there research? Are there studies conducted? Every aspect of the 4 resiliency strategies contains extensive research that confirms it. This is not an opinion lecture. It really is about the science of this. It's extensive, and each category, each one of the 4 resilient strategies has its own research body. So what I'd like to suggest is I believe Sierra Tucson is going to be sending out a thank you email somewhere in the near future, and I will attach a bibliography that at least can get you started on some of the research that confirms and explains the details behind this talk. The second question, actually from a few people, has to do with blood tests that might be used to measure systemic or metabolic inflammation. There are blood tests. Some of the studies I quoted that confirm inflammation and its role utilized both common clinical lab studies and blood studies that are basically used only for research. The most common clinical study is C-reactive protein. You'll find that this blood test is very commonly done. If you visit a cardiologist who wants to test your risk factors for heart disease, they'll get a C-reactive protein, or CRP, which is an indicator. Again, inflammation is a good indicator of risk for cardiovascular disease. In addition to that, though, clinically, there are indirect studies. The level of low density cholesterol, LDL, the measurement of chronically high levels of blood sugar, hemoglobin A1C, are indirect hints of inflammation. The other tests that are done in research include something called tumor necrosis factor and some of the chemicals that are called interleukins. So I hope that helps clarify that. The other piece I just say is when you look at the lifestyle factors that create the risk for inflammation, sometimes you don't need the blood test. You just know clinically you're living a lifestyle that either promotes an anti-inflammatory effect or increases inflammation. Okay, someone asked a question. This individual works with high-risk adolescents in financially challenged community. So these adolescents are exposed to a lot of damaging circumstances, a lot of trauma. And the question is, how do you work with the parents to help them buy into the importance of doing this work, this resilience work? And the answer is, I think it's the same process of education. I think this lecture itself might help people understand. The other really specific research is on adverse childhood experiences. There are good population studies that show the long-term consequence of children being exposed to adverse circumstances. And explaining that or showing that literature could be very helpful in understanding how important it would be to support individuals, adolescents, and children so that they don't have these lasting consequences to their trauma. Next question relates to the importance of learning style. So, we do have to personalize and individualize how we approach this resilience recovery strategy. I know for myself, there are people, right now I'm heading up the professionals and licensed professionals and executive program at Sierra Tucson. And a lot of those people really want objective information. I give them basically the same scientific lecture that I would give to you or other professionals. And then I have other people that would really prefer an experiential approach, and we really move into visualization and meditation approaches and actually doing some of the physical exercise and observing the effect and things like that. So absolutely important to individualize this based on your population and on the individual. Okay, I'm moving on to the next question. Someone asked about, what about patients who have incurable illness? We can't simply think our illnesses away. So this is absolutely true. I totally agree with that. Or people living with chronic pain, they're not going to think their pain away. Nor is someone with an addiction or a craving to use as a strategy going to be able to think that away. This is not about making problems disappear or conditions or illnesses disappear. It's about making the most of that. And as you can imagine, there's a difference between someone living with an incurable illness who possesses great resilience, who approaches their illness with a positive attitude, with a sense of meaning and purpose, a desire to connect to their loved ones while they still have time, a desire to live a healthy lifestyle so that they extend their life as long as possible. So this is not, the resilience strategy is not meant to be magic. Nobody just thinks their problems away or exercises their problems away, but we do have a different experience. We can lessen the suffering related to unavoidable situations that we need to face. All right, next question. Dr. Lerner, what strategies do you recommend to change or intercept negative thoughts before they spiral out of control? It's a great question. The answer to that really is that it takes practice. There is no quick way, just like there's no quick way if you have not been exercising to get in shape and be able to run a marathon. One has to take steps, get in condition, and have an exercise program that's done over time, and that's where conditioning happens. It's the same way both with thinking skills and with meditation skills. They do require practice. There's no doubt in the literature, for example, that people who meditate daily and then are measured both pre and post their meditation period, let's say 2 months, that there is definitely an improvement in their capacity to deal with anxiety, lower pain, improve mood. But you can't expect someone in a crisis the first time they meditate to be able to manage it well just by meditating. It is a recovery process, and that's why at the beginning I talked about recovery versus cure. This is really a process of learning and gaining skills. What resources would I recommend to learn more about anti-inflammatory diets? There are a ton of books out there that specifically describe anti-inflammatory diets. I will say with that, there are controversies, and some people will come down very strongly in terms of the inflammatory effect of wheat or gluten or dairy or corn products. The research may be weak on that, but some people still will come down very hard on very rigid diets. I'd say you've got to read a couple of books. If you take a look at the bibliography when I send it, you'll also see some references to the studies on diet, and you can begin there. It may be a good or bad thing, but there is extensive literature. If you do a Google search on diet or food and inflammation, you'll find a lot there. Next question, is there a specific book that you would recommend on restoring resilience in the manner which was presented? The books and the literature out there, in my experience and my reading, have not been integrated to take the overall experience, the 4 aspects of resilience, but you can find good books that will address any one of them. For example, there'll be great books on an anti-inflammatory lifestyle, and within that you can find books on exercise, a book on diet, a book on stress reduction and sleep, etc. So I think you've got to mull through that, and depending on what's most important to the individual you're working with bring forth that kind of literature. Likewise, there are good books from Peter Levine on that survival mechanism. The book on Body Keeps a Score. So a number of experts that will talk in detail about trauma and its effect and how to treat it. The thinking things, everything from pop literature on psycho-cybernetics and positive thinking to literature on DBT and CBT. Those things are all out there. The question is, how do you integrate that? Because right now the information isn't there. You could just show a lecture or this material. I am working on creating some online material that will be available hopefully in the near future. So with that, I think we've used up our time. Once again, I want to thank you so much for tuning in. Please keep your eyes open for a thank you letter from Sierra Tucson and myself, and some connections if you have additional questions or if you want to take a look at the bibliography information and want to talk further. I'd be glad to do that. Thank you again. Have a wonderful day.